Thank you so much for joining us today for an important conversation in which expert panelists will help us to understand the particular threats COVID-19 poses to the health and rights of workers in the U.S. meatpacking plants, and how this pandemic exacerbates and brings to the forefront already long-standing workplace risks. I have the good fortune of knowing many of you on today's Zoom, but for those of you who are new to us, I'm Donna McKay, the Executive Director of Physicians for Human Rights, PHR. Today's conversation is the 24th in PHR's COVID-19 themed webinar series, which since we launched in March has been examining the implications of the pandemic through the lens of health and human rights. We've brought together health workers, scientists, community leaders, and voices from the front lines on a broad set of topics as we seek to bring science-based analysis and approaches to guide responsive to this massive public health crisis. Today, we will hear from expert panelists and our very expert moderator as they discuss how the COVID-19 pandemic has further threatened the health of plant workers who are often forced to operate in cramped spaces that don't allow for social distancing and without the personal protective equipment that they need. As this pandemic unfolded, coronavirus has spread at such an alarming rate through meatpacking plants. It's estimated that more than 42,000 meatpacking workers in the US have tested positive, and more than 200 have died from COVID since March. But while workers, unions, and labor advocacy groups sounded the alarm, we saw frustratingly little response from the federal government. Earlier this month, we read reports that federal regulators knew about serious safety problems in multiple US meat plants that became deadly coronavirus hotspots this spring, but waited 6 months before taking action. So these conditions obviously become a crisis, not only for the workers themselves, but also for their families and the communities, as well as the safety of our food systems. So we're so fortunate today to have with us to moderate today's conversation, Anna Werner, who's a consumer investigative national correspondent for CBS News. Her recent reporting has covered the tens of thousands of confirmed COVID-19 cases and multiple related employee deaths tied to meat processing plants all across the United States. Anna's investigative reporting has revealed that while workers at JBS and Tyson meat processing plants were receiving hazard pay, many were stuck in an impossible position, forced to choose between jeopardizing their livelihoods and risking their lives and health. Throughout her tenure and as a journalist, Anna has been honored for her investigative reporting. She's received several RTDNA Edward R. Murrow Awards and Emmys. Anna, thank you so much for being with us today. I turn it over to you to introduce our panelists and moderate this really important conversation.
Thanks, Donna. I'm glad to be here. Thanks very much for inviting me to moderate. Pardon my voice there for a second. I think you gave a really good summary of sort of what's going on. I think a lot of people have heard about outbreaks tied to meatpacking and poultry plants around the country. The monitoring of data has been a sort of place by place to some extent. There's a nonprofit, the Food and Environment Reporting Network, that has been tracking the spread of COVID-19 since April in some of these facilities. They've counted, as of today, at least 796 meatpacking and food processing and 106 farms and production facilities that have had confirmed cases of COVID-19. By their count, at least 59,000 some workers have tested positive, and at least 253 workers have died. That's their tally, monitoring the data that they've been watching as a nonprofit sort of reporting outlet. The recent headlines you noted, recently the Washington Post reported that more than 200 meat plant workers have died, yet federal regulators issued just 2 modest fines for a plant in South Dakota, another in Colorado. And I want to give a nod to a recent article from ProPublica, which their latest headline saying that emails show that the meatpacking industry drafted an executive order to keep plants open. As we know, President Trump issued a controversial executive order aimed at keeping these plants open. The emails obtained by ProPublica show, and I'll quote them, that the meat industry may have had a hand in its own White House rescue. Just a week before the order was issued, the meat industry's trade group drafted an executive order that bears striking similarities to the one the president signed. So we haven't heard, I feel like we haven't heard that much about meatpacking plants lately because there's been so much breaking news. But it was suggested to me to play a piece that we had done at CBS News in mid-May. I think the story doesn't give you the total picture, but gives you a picture perhaps of what it's like for workers and what some of the responses from the companies have been as well. So we're going to play this short story that we did for CBS This Morning in May, and then after this we'll introduce our experts and get them to weigh in on what the latest is that they're seeing with the situation around the country.
We're going to turn to employees at meatpacking plants who are telling us that they are worried about their health, but they cannot afford to lose their jobs. An ongoing investigation found there are at least 14,000 coronavirus cases tied to 181 plants in the United States, and at least 54 workers have died. Our consumer investigative correspondent, Anna Werner, spoke to employees who say they are in desperate need of their paychecks, including bonus money, which some are calling hazard pay. Anna, good morning.
Good morning. Advocates say many workers are afraid to speak out, fearing they may jeopardize those paychecks. Those who did told us that even so some improvements have been made, they still are afraid and they don't feel safe inside the plants.
Oh my God, it's very hard for us. Very hard.
Maria didn't want us to show her face or give her last name, but her stress shows through. She works in Grand Island, Nebraska at the JBS Meatpacking plant, where many workers have fallen ill from coronavirus. On April 28th, one of them died. Her close friend, 61-year-old Reynaldo Ramirez.
Very sad for him. He's a good partner, good man. He died.
Ryan Brown works there too.
What is it like for you in your job in terms of a line? How close are you to other people?
We're pretty snug. There are some places where you are literally like shoulder to shoulder with somebody.
Some 3,600 people work at the JBS plant, which processes 1 billion pounds of beef each year. The company says it's doing everything it can to provide a safe working environment. Still, emails we obtained from the regional health department show at the end of March, a local emergency room doctor called the plant a hotspot. Another wrote, JBS should shut down for 2 weeks. That never happened. By April 21st, the health department reported more than 230 JBS-related cases. On its website, JBS cites measures taken to protect workers, including temperature checks and face masks, along with increased sanitation and physical distancing. But Brown says sometimes
there's no real feasible way to keep us all 6 feet apart. It's just a lot of people in one space, you know what I mean? It's just very congested.
To limit that congestion, JBS and producers like Tyson Foods are taking other steps. This Tyson video shows improvements, including workstation dividers, on-site medical screenings, and social distancing. Meatpacking companies have also increased pay for workers during the crisis. Tyson announced 2 $500 bonuses in May and July. JBS has raised hourly pay and is giving a $600 bonus to workers who had no more than 2 unexcused absences between April 20th and May 15th. But Mark Perrone, president of the UFCW International Union, which represents many workers, is skeptical.
They want people to come to work, so they're paying them more money. The problem with that is it puts them back inside the plant.
JBS workers who stay home because they fear contracting the virus won't lose their jobs, the company says, but they also will not be paid, which Perrone says leaves many workers with no option but to work because they need their paychecks.
Just because you're an essential worker doesn't necessarily mean you're expendable. And I think that people have started to think about these workers, especially in these packing houses, as being expendable.
But George Washington University expert Melissa Perry says keeping workers safe protects the meatpacking business as well.
I think it's a false dichotomy to frame it as though it's a choice between workers or our meat. That's really not the issue. The issue is it's a choice between ensuring safe protections within meat processing plants so that we can continue to have a steady, reliable supply of meat.
Back at JBS, Ryan Brown is making $4 more per hour now, but says money isn't the answer.
Where you're putting people's families like at risk and like their lives at risk, I don't think that you can put a number on that.
On its website, JBS says it is encouraging sick team members to stay home from work, and it has relaxed its attendance policies. They also pointed out that no one has asked them to close the plant. Local health officials say that's because they couldn't get support from state officials to do that. We reached out to the governor's office, but never heard back, Gail.
Okay, so we're back. Hopefully everybody can see me. I'd like to introduce our panelists for today. We're joined by Axel Fuentes, who is Executive Director of the Rural Community Workers Alliance, which is a Missouri-based organization that works to build and strengthen the engagement of low-wage immigrant and refugee workers in their local communities to secure improved community health systems and services and ensure workplace safety for food industry workers. David Muraskin is Food Project Litigation Director and Senior Attorney with Public Justice, where he focuses on litigation to promote sustainable alternatives to the industrial animal agriculture system. He represents ranchers, farmers, and consumers exploited by corporate consolidation in the food industry. And Melissa Perry is professor and chair of the Environmental and Occupational Health Department at George Washington University's Milken Institute School of Public Health. She's a leading public health researcher whose studies have investigated factors in occupational injury and disease, particularly in meatpacking plants. Welcome to all of them today. And I think, Melissa, I'd like to start with you. Can you give us a sense of why it is, and you've explained this to me as you did for our story, why it is that meatpacking plants and poultry plants may have such a difficult time of countering infections with COVID-19 and the virus in their plants?
Sure, thanks very much, Anna. I'm really delighted to be here. As an epidemiologist, as a scientist, as a researcher, by all indications, we're talking about an epidemic among meatpacking workers of the coronavirus. And it, in my opinion, is not a mystery as to why that's happening. It has so much to do with crowded conditions. So most people have never seen inside a meatpacking plant before. It's largely been hidden from public view. And so it's important to understand how fast-paced the work is, how line-paced it's dictated by, and also how crowded. So we're really, without exaggeration, talking about shoulder to shoulder, elbow to elbow. And so plants have attempted to use various protection measures, including masks, including increasing hand hygiene, but the physical distancing has not been implemented. And so still workers are close together and they're still breathing on each other. And in my professional opinion, that's why we're continuing to see these outbreaks.
Axel Fuentes, in your work with the Rural Community Workers Alliance, you're constantly speaking with workers. We've seen, as we saw in the story, that companies have taken measures to try to improve the situation. I've heard reports that in some plants, workers have said that they feel like some situations have improved. What are you hearing from people who actually work in these plants?
Well, first of all, thank you for inviting me to be here. In the meat processing plants, always been really difficult and hard working conditions. And since the beginning of this pandemic, I think the inactivity of meat processing plants to protect the workers was a key issue, because the plants didn't act fast enough to protect the workers. So one of the things that we hear at the beginning of this pandemic, obviously, was the concern of the workers getting infected. And either when the workers attempted to, that means approached management to address this situation, the workers were kind of ignored, because the companies, I think they were afraid of getting shut down. So the workers didn't have much options to protect themselves, and the companies didn't act enough. So right now, yes, some companies have improved and have taken some measures to protect the workers, such as the distribution of masks or installing plastic separators, but still, the workers are still working shoulder to shoulder. And I don't see that the companies are actually paying enough attention to the emerging issues. What I mean is they are so focused in getting the production done than paying attention of what the workers are suffering of. And I'm going to give you an example. Just what I'm hearing in this particular plant up here in Missouri is that the companies now are, yes, they are getting masks, but the company is not paying attention that actually the mask is becoming also an issue for the workers, because since they are sweating a lot, so these masks are getting so wet that makes the workers very difficult to breathe. Same thing with the face shields, that they get foggy and makes the workers more vulnerable to stab at each other. And those things, even when the workers complain at the management, so they feel like, okay, we are giving 2 breaks, so at the break time you can go and request another mask. But it takes time for the workers to go and request. They only have 15 minutes break, and then a lunch break by noon or at the middle of the shift. So it makes harder for them to get even replace those masks, to get a fresh and new mask. Other thing is that they feel like the physical separation, yes, as I hear before, is hard to be implemented, because the company is now more interested in getting the production done too, even when there are less workers attending every shift of work, because some of them are either in quarantine or they've been in close contact to someone who got tested positive. So the companies are not replacing those workers. So in other words, the same production is getting done with less workers. So that makes feel to the workers like they are working faster, even faster than before the production. And they feel like the speed of the line is affecting them. So there is more problems for repetitive injuries or more vulnerable to suffer accidents.
Axel, thank you. Good perspective coming from inside the plant as you hear directly from the people who work in those plants. David Muraskin, in your work at Public Justice, I know that we know that a lot of workers are hesitant to speak out. I'm interested to know what then your legal strategies are as you are working to try to make a difference in this situation. Perhaps you can sort of give us a sense of what you've been working on and what you think has been successful for you.
Yeah, and I echo everyone's thanks for having us here on this, what we think is a really important subject to be highlighting to the public more and more. So I think the thing to highlight from the get-go is how the major protection that we expect to be in place has totally fallen down. When we think about legal protections in the workplace, we think about OSHA, the Occupational Safety and Health Administration, which is meant to protect workers. That's its core function. It's under the Department of Labor. What OSHA has done here is totally throw up its hands. The longest serving director of OSHA, David Michaels, who served under the Obama administration into the Trump administration, referred to OSHA as AWOL in this entire pandemic for protecting workers, particularly protecting meatpacking workers. They've refused to issue any kind of enforceable guidelines that would require the companies to take particular steps. When you look at their specific guidelines on meatpacking, they allow all this wiggle room in the language, if possible, if feasible. And we increasingly are seeing documents come out in FOIA that was written by the meatpacking lobbyists in order to give them excuses to not protect workers. And so what we have is a system where the major legal protection has failed. It's just totally absent from the playing field. And so the question is, what do we do? In one case, we are actually suing OSHA. We're representing workers in the Made-Right plant in Denmark, Pennsylvania. Made-Right produces pre-made school lunches and things like that. And we're suing OSHA, saying that OSHA's failure to act there was a degradation of its responsibility to the public and to workers. The other thing we're doing is we're having to go back to laws that predate our kind of New Deal system and think about how we can reframe the issues that are going on in the plant. So, for instance, we represented Axel's organization in Missouri to say that what Smithfield was doing there was creating a public nuisance. That's the notion that every property owner, be it a business or a homeowner, has an obligation to their neighbors to keep them safe. This originates from a 1902 case where a homeowner had a pond on its property that was breeding mosquitoes, and those mosquitoes were infecting neighbors. What we said was a meatpacking plant's a lot like that pond. It's allowing the virus to spread. It's allowing the virus to get into the community. That's creating what's known as a public nuisance. Ironically, the court in Missouri told us we should go to OSHA and seek OSHA's help. And that's how, so our case was dismissed. But that theory has now been replicated elsewhere to much more success. So McDonald's workers have gotten protection that way in both Illinois and California. Amazon workers are using a similar theory in New York right now. And it's those kinds of bedrock principles we're having to turn to because the kind of more recent principles, although they date to the 1970s, have proven so ineffective under OSHA.
So a question from an attendee that came in, and I think Melissa Perry, this probably goes to you. They're sort of asking something that I think occurs to a lot of people, which is, what does epidemiology tell us about the operator's responsibility for the spread of the virus rather than the virus in the community at large? Can you tackle that?
Sure. It's a really important epidemiologic question, and that's where I continue to come back to as I think about these outbreaks and this epidemic. There's some real basic infectious disease, airborne infectious disease control methods that are in place across the country, if not across the globe. And that is to be able to reduce transmission via droplets or aerosol by breathing on each other, by wearing masks, and also by maintaining physical distancing and hand hygiene. And what's not happening in the plants, again, is the physical distancing. And as Axel explained, in fact, we're going in the opposite direction by increasing the pace of the line and therefore crowding people together more so. There have been physical barriers being put up between people, but that's not restricting the proximity that workers are in. And in fact, can really interfere with the workers' ability to even move within their tight quarters. So they're not adhering to 6-foot physical distancing. So imagine more than 8, 9, 10 hours where you're doing thousands of times of repetitive task. In our research, we calculated that the average worker was conducting their task. They had 4.5 seconds to conduct their own task on the line before they had to go on to the next piece of meat. So imagine those conditions and then question whether or not there really are specific high-risk circumstances that workers are getting exposed to. By all indications, it's a crowding problem that has not been addressed by the industry. In fact, it's been resisted in terms of intervention.
And how crucial is testing, ongoing testing in the plants? And do you believe that that is happening on a consistent basis around the country in plants?
You ask an important question about my belief. What I'd love to be able to do is to go to one central source of surveillance data. The country deserves that. And so just as we have a crisis in workplace regulation and protection enforcement, we also have an epidemiologic crisis in terms of surveillance data that we can rely on. Right now, the best public health data, the best epidemiologic intelligence data are coming from investigative reporters. So from my assessment of the reports that come from health departments into local newspapers, by all indications, there has not been uniform testing, and actually there's been resistance to that in various states. So that's not happening either, even when health departments are strongly urging plants to implement wide-scale testing.
We spoke a little bit about OSHA. We talked about how there have been stories saying that OSHA had issued just 2 fines. I know that OSHA has defended its position and said that it has been acting within the authority that it has. We had a question, though, from an attendee as to whether OSHA has been responsive or helpful or not. Is there any policy work happening for OSHA, for workers to bring a private right of action under OSHA? And David Muraskin, I'm going to ask you to respond to that.
Yes, there's a lot to unpack there. I guess the top line thing to recognize is OSHA has several powers that it's not using. So what we're suing over, for instance, in Pennsylvania is something known as its imminent danger power. It can go in and immediately correct conditions at plants, which it has not used throughout the pandemic. It could have issued a standard. In fact, the AFL-CIO sued to demand that OSHA issue a standard. And OSHA fought that suit and won and said, you know, it's our decision whether to issue a standard or not, and it chose not to. And those standards can define the contours of the what employers are supposed to do. Instead, OSHA is doing something called proceeding under its general duty clause. What it's saying is it has the ability to protect workers generally, and that's sufficient. The problem with doing that is OSHA is innately slow. It has 6 months to issue a citation, and it almost always takes those 6 months, and particularly in politically sensitive areas where regional offices have to send their recommendations up to national office, it will take 6 months. And that's what happened with those 2 meatpacking citations. These were issues that happened in April and May, and that OSHA took essentially the entire 6-month period to evaluate those plants and then issued meager citations. You called them minimal. I would call them almost non-existent. They were $13,000 and $15,000 citations for workers dying on the job. But even when OSHA does that, the companies then have an appeals process, and that appeals process goes to a 3-member board, which almost always does not have its full panoply of members because they're politically appointed and we can't get people to agree on the appointments. And that means the board can't act. And so the appeals process has taken as long as 18 years and regularly takes as much as 1, 2, 3 years to go through. And during that point, the company doesn't have to respond to the OSHA citation. OSHA is just not built to address these kinds of imminent concerns. And it's really also consistently ignored meatpackers. Something I want to emphasize about what Axel described is, you know, the repetitive stress injuries that Axel talks about could be regulated by OSHA. In fact, OSHA tried to regulate them in 1999. Congress then passed a law saying that OSHA could not regulate repetitive stress injuries. So OSHA has been curtailed, and the ways in which Congress and the executive branch has limited its authority is something I think we should come back to. You know, the executive order is a lot less than meets the eye, but it's been about creating a patina for OSHA to say, and others to say OSHA can't act.
Axel, we're talking about what what federal OSHA, you know, is or is not doing, how effective they are or are not being in this. Do you get the sense at the ground level that local, state, or federal officials or agencies are helping the workers? I mean, what are they doing? Are you seeing them take actions that are helpful or not?
Anna, honestly, what I hear from the workers is the workers actually are feeling thoroughly hopeless from the government institutions. Since when they were forced or obligated to go back to work without protective equipment or without measures to protect them to spread this virus, the workers were feeling like we are being used. We are feeling like they are being sent to be sacrificed, because that's the reality. Workers in our community, in this specific community of Nyland, they were asking the company to shut down at least for 2 weeks, but that never happens. And the workers were going to work every day, but not because they wanted. It's because they were sent to work. They were forced. Otherwise, they can get terminated, because there is also a system of negative points. If they accumulate X number of points in a year, they can get terminated. So it's the same way that they are feeling now, just at this moment, when nobody is actually paying attention again for those emerging issues that are just that this pandemic is developing. So the workers are feeling thoroughly hopeless from the side of the companies and hopeless from the side of the government institutions that's supposed to protect them. So that's the feeling that I can get from the workers, and that's what I hear in every conversation with the workers. They say, well, we don't have where to complain. For those workers, for example, that already got the virus and they are feeling side effects right now, there is nothing to protect them to. So totally hopeless.
I think this is, if I could jump in about the executive order here, because I think it's important to understand what did and didn't happen. So Trump's executive order cannot and does not force plants to stay open or force workers back to work. But the Defense Production Act, which is how Trump issued the order, allows the government to take preeminence in contracting. It can force a company to contract with the government rather than a private entity. And if the private entity had a contract, it can protect that company who's selling out to the government from being sued under that contract. It's not about worker rights or safety, but what happened was, and I think what the ProPublica article, Anna, that you mentioned at the beginning really highlights, is that it was issued as a way of cover and to give both the plants and the local officials cover to not act. What they could say by pointing to the executive order was that, look, the government wants us to stay open, and so you shouldn't close us down. We need to keep on operating. We need to have people in the plant. There's nothing legal about that. It's an argument, and it does not actually affect these individuals' rights, but it's so this kind of noxious way in which the government has played cover for the companies. To answer the final component of the question you asked me earlier, there is pushback in Congress now as something known as the HEROES Act, which would require OSHA to issue a standard and potentially create other workers' rights. Whether that actually gets passed as part of a COVID-4 package remains highly unclear, but that the HEROES Act is the way in which we can restore some of these worker powers and push back against this malaise of inaction and coverage.
So in regard to the executive order, as you were explaining what it does or doesn't do, or what it can or can't force local jurisdictions to do, and I've recently heard of a local county here in California that did actually close a plant down for about a week based on a local health order. I'm wondering, Melissa Perry, do you think that that is happening often, frequently, hardly at all on a national basis? Are you hearing about that?
It's hardly at all, Anna, and I'm pretty certain about that. I think California was absolutely the anomaly. And at the same time, as you pointed out at the beginning, we got started on this, I guess, back in April, and we kept on benchmarking the numbers of cases that were being reported. CDC did do an investigative report and updated in July. At that time, the number of cases was 16,000. They acknowledged fully that that is going to be an underreport of what was happening in July. I really want to emphasize that when we're talking about who's being affected in meatpacking, there's about 500,000 people that work in meatpacking. At least half of them are Black, Latinx immigrant employees. And in terms of the cases of infections and deaths that the CDC reported back in July, almost 90% of them were among Black, Latinx, and immigrant workers. So this is a really important point to explain the lack of attention and the lack of power and focus in recognizing who's being disproportionately affected. So as I mentioned, we have a crisis in data. We need a national surveillance data system. I did work inside meatpacking plants for 7 years. Our group at Harvard was one of the only groups that could even get access to meatpacking plants. So there is a lack of information, but by all indications from investigative reporting, from newspaper articles that we've had access to shut down plants is a very, very rare circumstance. And by all indications, plants are in full operation now. As you might remember, a lot of concern about a dwindling meat supply. Well, I don't know about our viewers, but by all indications in the supermarkets in my area, there's plenty of meat. So volume and production is back up to full scale, but at the same time, outbreaks continue.
And Axel, I know that for many of the workers, it's a very tricky decision to decide to try to either speak out or be part of organizing. We've heard from the unions the UFCW, for example, which represents a large, huge number of workers. But we know that there are certain plants where there are no unions, some 30%, I think, and a lot of the poultry plants that are unrepresented. And I'm wondering about the impact, too, of the changes in immigration policies and approach under the Trump administration. Do you get the sense that that has had an impact on workers' ability and or willingness to come forward and talk about their concerns?
Yes, this is something that always been in that way, and increased obviously now with the COVID-19, because the workers are really afraid of filing complaints even to the human resources offices, because they feel like they are going to get retaliation against them. Or in some cases, obviously the immigration status can play a big issue, because people feel like, okay, if I complain about this, I can get terminated, and who knows, maybe I can even get deported. So yes, this is something that keep the workers down, keep the workers away of complaining, and even for us organizing in the communities, we can thoroughly clear see that when we ask even a worker, can you do an interview to a newspaper or a reporter? They say, oh, no, I'm not going to do that, because then the company is going to find out and I'm going to get terminated. Obviously, the company is not going to say, we are firing you or we are terminating you because you are filing a complaint with OSHA or with talking to a reporter. No, they find other excuses or other ways how to terminate the workers, and could be even immigration status. I remember cases in workers' compensation, for example, where from workers that have been working there for 10 or 12 years, and then when they file a case, eventually they say, oh, I'm sorry, but your Social Security is working somewhere else. And they terminate the person for that reason, even when that worker's been there for years. Or now, for example, with the speed of line, workers feel terrified of complaining in the human resources or OSHA, because they say, well, if we are complaining, they may terminate us. And now our family in our countries is also depending on us. So it's very tough situation right now.
Actually, you brought up a point that one of our attendees had a question about too, which is the line speed waivers, the ability to speed up the lines. And this was something that was actually put through prior to the pandemic, as I understand it. And Melissa, I think that you could probably address this because I know that you were in the plants, you spent years watching workers on these lines. Explain to the audience, why is line speed so crucial, even when you talk about COVID? And what was the impact, or what do you think is the impact of allowing companies with waivers to speed up those lines?
It's a really central point here. And as you point out, it's important for our audience to understand. The vast majority of us have never stepped inside a meatpacking plant. There's very little visual, very little reporting, because there's no access. So how do you have a common conception of what meatpacking looks like? It is by and large, high volume, fast paced, very physically demanding work. And the plants that we worked in, they were moderate sized plants. This was in pork. Imagine 1,000 hogs an hour and 8,000 a day. In order to produce that much, you need to keep that line going as fast as possible. And that is where, as it relates, and so yes, workers are at a much higher risk for repetitive strain, and our data were all about cut injuries and the ways in which workers are being cut while working so fast and so intensively. For the coronavirus, we're getting back to this issue of crowding. In order to maintain and enforce 6-foot physical distancing, you have to space workers out. That means slowing the line down in order for the meat to move more slowly across the line. What's happened during this time? In fact, there have been several waivers, especially in poultry, that has allowed the industry to speed up, to indicate that we're on the verge of a meat crisis. And so it's the opposite direction of where we need to be going at. We can produce meat in a much safer way, providing workers that protection, but we need to slow the line down.
David, I know the companies, have spoken out in their defense, and the industries have, and they've said, that they are doing the best they can, that they provide a crucial supply for the country of meat, that people need food to eat, and they need meat and poultry. And so as someone who is, advocating legal strategies to try to work on these situations, how do you respond to that? I mean, how do you respond, David, when the companies are saying, look, we're working very hard to protect our workers, we're doing the best we can, and we provide a crucial supply for the nation?
Sure, I think there are two separate answers there. One is that they're simply not doing everything they can. To echo Melissa's point, they can space workers. We know as a practical matter, you can slow down the line, space workers apart. That will have the effect of actually helping with the repetitive stress injuries that Axel mentioned. It also will have the effect of protecting against COVID, and that will allow the plants to stay open and produce meat consistently. Maybe they would have to reduce their production slightly on a year-over-year basis, if that were the case. But quite frankly, every industry in America has been affected by the pandemic. The notion that our meat production shouldn't be is a little bit silly. But beyond that, and this is the second part of the answer, there's no meat shortage in America. There is an immense amount of meat in what's known as cold storage. In fact, there's more than we've ever had in the past, is my understanding, because we were not shipping abroad, because there's been such a drop in consumption at other countries. And in fact, one of the things the Defense Production Act can do, and it's not been used for, is to force these companies to contract with American suppliers to sell to American consumers rather than ship abroad if that were actually a concern. It's not a concern. What the concern is that these companies, if they were to reduce their production, might have to ship a little bit less abroad, and therefore they profit a little bit less. That's the only concern here. And that's what we need to recognize. This is purely about ensuring shareholder returns and a high stock market value, and not about American consumers or particularly the American worker.
If you have continued COVID infections in plants, if you still have that as a problem nationwide, Melissa Perry, how does that affect communities' efforts to control their COVID infection rates, community-wide?
It's a critical point. It's been a point from the very start of this, and that is that it's not only the workers themselves that are being infected, but they're bringing infections home. And for a while, it was very interesting. There were competing theories that were coming out in the media that maybe it's the conditions of the workers at home that might be increasing their risk, which was running counter because we were seeing these kinds of outbreaks not only in the US, but in other countries as well. So how would it be that something unique about meatpacking workers was attracting risk for infection, both in the US and in other countries? So it means that being infected at work, given very crowded conditions, again, so many plants and so many states reporting outbreaks, and essentially super spreader events as we've been seeing, bringing that home to family members and community members, therefore results in more infections within the community. It only follows, and it brings us back to airborne infectious disease epidemiology 101.
Axel, if you, in your work on the ground, you're hearing so many people, if there was one thing that you think would make the biggest difference for the workers you speak to, one thing that any agency or a government or anyone could do, what do you think that thing would be?
I think it will be regulations. One major problem in the meat processing plant is the speed of line. It's what's being called speed of line. That brings a lot of problems. It will be a regulation for that will help, even to encourage the workers to either get organized, if that will be the ways to empower them to get organized and make exercise rights. But it's, at this moment, there is not a regulation for the speeding, for the speed of line. So this can go as much as the company wants because nobody is regulating that. So let's say if they will regulate the speed of line, that will reduce a lot of the risks for the workers and also for the food. That will protect in some part the consumers too, because the speed of line is a big problem also for risks of contamination of the food. So I would think that that would be one thing if they could at least to alleviate some the problems. That will be one thing that workers probably will be asking for.
And so I'm thinking that a lot of people may have this next question that an attendee asked, and perhaps it's a good question to sort of, for each of you to sort of wrap us up here as we get into the last quarter hour of our seminar, which is, as consumers, you know, people who are listening may want to know what they can do. Can you give us a few things, 1, 2, or 3 things that you think people listening could do to be helpful in this situation? And Axel, I'll start with you.
Thank you. First, I will say, get to know where your meat is coming from, because a lot of the meat that is being consumed right now in the world is coming from this mass production, these big companies that are producing most of the meat. Just very few companies are producing. There is not much alternatives or much choices where the people can do. Then also something that I always say that I don't want to. I'm not really a political guy, but I will say, get to know who are you voting for too, because in many cases, the people that are voting for elected officials that may be even against their own interests. In the case, for example, of working class, that would be other thing important to do, and then get educated to know what's beyond the package of meat that you see in the store, because that meat can come from one of these companies that are not really protecting workers or protecting even the product. And then be just also consumers needs to know that in a lot of these meat processing plants, minorities are working. A lot of African Americans, Africans, and Latinx. So be aware that a lot of the workers that are being exploited are from other races.
Thank you, Axel. David Muraskin, what suggestions would you give to consumers? And I'm wondering, are there things that you yourself do and keep in mind, you know, given the work that you do?
Well, the thing I think people need to recognize is this is not a consumer problem. We're talking about a system that has allowed gigantic companies to consolidate and come together, wield an immense amount of political influence, and use that and emphasize corporate profit over their workers, the land on which they operate, the farmers who work for them, the neighbors who are affected by their operation. It's a real, there's often this language of kind of voting with your fork that people adopt. And I appreciate the concept, and I'll answer your question about what I do, because I do also try to practice some of that myself. But I do think at bottom, we have to internalize that this is about a system that needs reform rather than putting it on the people, because when we put it back on the people, we let politicians off the hook and we let the system off the hook. You're not gonna, no individual is going to purchase their way out of this, and no collection of individuals can purchase their way out of this. That being said, there are some systemic things we can work to fix. One is, I do think the HEROES Act, if you want to make a call today or tomorrow to your legislature, that is the thing to promote, and we need to make sure that's a part of the COVID-4 package. Similarly, we need to make sure that McConnell's immunity bill does not become part of the COVID-4 package. What the Republicans are trying to do are trying to prevent suits on behalf of everyone around the nation, including workers. And those are currently our only tools to hold companies accountable. Two, I would say we need to emphasize more organizing. You know, the unions have been, for a variety of reasons that have nothing to do with their management or structure, been gutted over the last decade. And we need to find a way in which we can empower workers to begin to organize, because that's how Melissa gets the information that she needs. That's how I get in contact with people and are able to bring suits that highlight issues. It's about how, so Anna, how about you get people to kind of come on your show is through having someone like Axel on the ground who can empower those workers and tell them how and help them feel that they can get together and do something and work together. And we need to put the time and resources into that, because otherwise we're going to lose this battle altogether. You know, what I do myself is I do try to be mindful of where I purchase. I try to only buy from companies that are really farmers that I know. I try to avoid the mass-produced meat because I don't want to support this system that is exploitative. I do that because I think it's morally right, though. I want to be very clear that I don't do that because I think it's going to have a policy change. My work is how I have a policy change. My home is just how I try to live my life. And I think we need to kind of recognize that it's these broad-based things we're going to need to put efforts into.
Thanks so much, David. And Melissa Perry, I think that means that you get the last few minutes here to tell us what kinds of steps you think people can take on an individual level, and are there steps, or do you agree with David that you're not going to fix a system, you know, by changing what you pick up with your fork?
I guess it's yes and no. I agree with David that we're not going to entirely rely on consumers to solve these major problems, these major workplace problems, worker health and protection problems. At the same time, I feel as though our viewers they've already taken the first step, and that is they're educating themselves. They are learning as much as they can about this issue. That's what I would strongly recommend. When we were publishing papers on cut injuries in meatpacking workers over a decade, they didn't get a whole lot of attention. And as I say, the average American has very little conception as to what the conditions are inside meatpacking plants, even though we're so very reliant on these workers. So opening up and demanding more information about meatpacking and the conditions for workers, I think is a major need that our audience can respond to. There's a saying that it is expensive to live this cheap. And what that means is, in the context of this pandemic, is that for the last 20 plus years, we've allowed the public health infrastructure for the country to erode. We've seen a loss of about 250,000 public health jobs. So when I'm clamoring to say we need a better integrated surveillance system to understand exactly in real time, as accurately as possible, what the circumstances of these outbreaks are, and that every member of the public can go to a central database in order to see that information, that is the responsibility of, and is a public good that really our government should be held accountable for. So the average citizen can request that, to say transparent and accurate data about health and safety is a necessity. It's not a privilege, it's a right to have those kinds of data. And then being aware, as I say, the fact that of the cases of coronavirus and the deaths, 90% of which are among immigrants, Blacks and Latinx individuals, all of us have a role to play in speaking out when vulnerable populations are being so adversely affected. So I think there's a lot that the average citizen can do, and for the physicians that are tuning in, for the other health professionals that are tuning in, this is a shared issue that we can all push toward seeking some resolution.
So Melissa Perry, thank you very much. Melissa Perry, who's professor and chair of the Environmental and Occupational Health Department at George Washington University's Millikan Institute School of Public Health. She has the longest title of everybody here. David Muraskin, the Food Project Litigation Director and Senior Attorney with Public Justice, and Axel Fuentes, who is Executive Director of the Rural Community Workers Alliance in Missouri, working with workers down there on the ground. Thanks so much to all three of you for enlightening everybody who's been listening today, and thanks to everybody who offered up a question on the attendees. Some great questions coming there to help me out. And Donna McKay, we'll throw it back to you.
Oh, Anna, thank you so much for moderating this really important conversation today. It's really such a gift to have an investigative journalist, reporter moderate, and we really appreciate your skills, but also your advocacy for many months on this issue. I also want to thank our panelists, Axel, Melissa, David, for bringing your really important understanding of the issues in this conversation, and for taking us inside a meatpacking plant today. And really importantly, for bringing us your recommendations for making an impact on this crisis. And I really appreciated the opening up of this discussion with the powerful stories of people on the front lines of this pandemic who are suffering disproportionately. You really got our conversation going with where it really belongs, which is about human lives and who this is impacting. You're amazing. It was 55 minutes in this period, and we managed to cover an enormous amount of issues. But as you all made clear, this crisis is not it's not the result of a lack of understanding of interventions that give us the best chances of keeping workers safe and healthy, but really the political will. You all gave us so many great ideas for policies and practices and some very real practical solutions that every one of us who is on this call today can do and participate in, including a number of policymakers who were with us today. And so I'd just like to encourage every one of you on this Zoom to share this conversation. It was recorded and it will be put on our website shortly and out on social media. Share it with people who are in positions to act and who are interested in learning more. The point of PHR's webinar series is to provide experts and advocates to have a platform to share their important perspectives, which they certainly did today and will continue to do that. So we hope you'll join us in future conversations. So thank you all very much. Stay safe. We look forward to seeing you again.
Thanks very much.